If you are just joining us, this is our coronavirus update live from Fox, where we check in from across the country and across the world just to bring you the very latest. I'm Claudine Wong. You can be watching on coronavirusnow.com right now. You can also be watching on Facebook pages at our sister stations across the country. We're going to go for an hour today, so we've got about 40 minutes left and a lot to cover. So I want to take you right now to San Francisco and Dr. Vanila Singh, former Chief Medical Officer of the U.S. Department of Health and Human Services, now on the medical staff at Stanford. Dr. Singh, thanks so much for joining us again. We appreciate talking to you always. I want to get right to just the way this information is coming in and our response to it. We just heard from New York and the situation there. We've got a Navy ship in New York. We've got a Navy ship in LA. At the same time, we've got this social distancing, this national social distancing guideline extending until April 30th. Is this enough? We're always asking, are we doing enough?
Well, we certainly wish we could always do more. And by the way, good morning, Claudine. Great to see you again too. I think that there's always an ideal, perfect place that we wish we were, which really is that this was on the decline or gone. But we're in the midst of the challenge by nature of the virus, which we don't control. So when you look at the actions, we are trying to, as a society, go against our own natural inclination, which is we are social creatures, and to keep each other away. We are, by definition, people who need to earn a living, want to earn a living for our family, security, for the future, etc. That's being minimized. And at the same time, we are trying to very rapidly develop therapies to help lessen the symptoms of this very challenging virus because it's new. If we had had a head start in time, I think we would be where we want to be. But having said all that, we know that there are trials underway. I think I've discussed this with your viewership in the past, but we know that the trial for the vaccination, one of the many trials, but the one in Seattle, Washington, was done in a record amount of time. We had a head start because a company that's working with NIH on that vaccine trial was working on the SARS original virus, and so understood that that knowledge is being applied as it is in so many cases around the nation. We know that the FDA just issued last week a emergency use authorization for point of care diagnostic tests that would be much easier in terms of allowing results within hours at the point of care, meaning hospitals, urgent care clinics, and emergency rooms, et cetera. That's a huge advancement right there. We also know that there are trials going on right now, for example, with Kevzara, which is the Regeneron product. It's a monoclonal antibody, and that is looking at means to decrease symptoms with fever and certainly need for oxygen, but also just need for hospitalization in general. And there's so many other efforts, which I'm happy to get into with the viewership. But when you say, hey, are we where we want to be? Can we do more? Of course, the science can be endless, but that we are doing it in this record amount of time with really an all of America approach, I think is what we have to see. It is not easy to mobilize this kind of know-how, coordinate it, have the infrastructure, whether it's scientific, or have the infrastructure, whether it's the trucks getting the food supplies or manufacturing supplies to where they are. So just in a nutshell,
Dr. Singh,
I'm very happy to see the nation do this.
that's good, and that's good news to see that we're on a right path to get somewhere. I wonder if, I would love to break it down, if we can, in each category, in terms of what we can look forward to, because people are grasping for any sign that we can get ahead of this and when we can get ahead of this. I wonder, though, when we talk about the speeded up timelines before we get into specifics, they said a vaccine was a year to 18 months out. There was no treatment on the horizon, and even if we had the chloroquine or the different things that we were talking about that show some promise, when is the earliest? So, we want the hope, but we don't want false hope. We don't want hope too early in terms of when we can do this, that we will see an ability to get back to normal life. That if all of these things go well, that we might be able to hug someone and not feel like we are putting them at risk or ourselves at risk or our families at risk.
Yeah, such a great question. That is the, million billion dollar question really, is when are we going to get back to normal? As you know, no one can really state that right now, but we can make projections based on worst case, best case models. The 15-day effort has now been extended, we know, to April 30th. I think the purpose of some of these projected timelines are really to ensure that people stand ready for those times when we do need to and can open up, because even that effort will take maybe even more effort than it is to shut things down. And much of it depends on what are some of the results, the preliminary results for those studies that we know are there for the therapeutics. We've heard the anecdotes about the hydroxychloroquine that you just mentioned, the phosphate or sulfate and the
Mm-hmm.
chloroquine phosphate. And what is the word that's coming back? We know that those are being utilized more extensively in the New York hospitals. The stockpile for it was purchased by HHS. It's been allowed also compassionate emergency use as well by the FDA. So the question is, if all of these things start to pan out, that rapidly addresses our timeline in the sense that we know perhaps either they could be prophylactic in development of symptoms in those who have the virus, or they can help reverse the symptoms perhaps if they're so
Yeah.
those measures will make a very big dent on our timeline. Hard to predict, but I think that the monitoring of our nation and the modeling of how what is happening in New York City, could that occur in Chicago or New Orleans? And to get those cities ready, which I believe their governors are all in and are considering their own actions, is very important
Yeah.
while the medical scientific community works hard at trying to ward this off.
So, Dr. Singh, that leads to my next question. So, a best case scenario, New York has talked about maybe seeing the peak in 2 weeks there. Obviously, if people don't socially distance or, people don't shelter in place, that could extend out. I mean, that's why we're doing all that we're doing. But then it goes, where is the peak in California? Then, if you talk about New Orleans or Florida or Michigan, their peak is different. Will you see our inability as a nation to kind of open up at the same time because everyone's on a different timeline?
Absolutely. We are on a different timeline. I don't imagine there's one day that the whole nation opens up, but I see that perhaps, again, this is all theoretical based on what some of our experts are saying, and perhaps what that means medically from a public health perspective, that regions, areas that have the capability of doing all the important CDC guidance in disinfecting areas, having the hand hygiene availability, the ability of that workplace to have social distancing. What kind of industry is it? Plus, what are the workers like? Are they post COVID? Do they have potential immunity? And how many are there? Are they low risk people even if they haven't had COVID? And how do we address that? I think those things will help determine it. A day of, kind of a dramatic opening of the United States, I think that kind of a day where things just come back to normal will likely take time. I also hope and believe that we are learning every single day more and more about how to approach this. So what's happening in California and in New York and Washington State are lessons learned for getting prepared in the other cities. Because there's no doubt in my
Yes.
mind that the governors and the state offices and the counties are considering, hey, if we need to, and this model worst case scenario happens, what would we do to get more beds, more hospital beds? How do we consider what is a non-COVID hospital and what is a COVID area? Do we have enough ventilators? Those discussions have been in weeks. And so my hope is that there are lessons, hard lessons learned from our great friends and family in New York City and in New York State.
Yes, I hope so too. All right. Dr. Vanila Singh, thanks so much for joining us. I really appreciate it, your insight and your thoughts. And yes, hopefully our lessons learned in other states will save lives across our country. So thanks so much, Dr. Singh.
Absolutely. Thank you.